All right, so I am going to ask the System of Care team to introduce themselves. And to start off, I'm going to ask the California Department of Social Services, Ashley Franklin. Can you start us off this morning?
Absolutely. Good morning, and thank you so much for joining. It's great to see that spread across all the disciplines, and very exciting to see someone from a tribe joining today too. So thank you all for joining. I'm Ashley Franklin, as Nancy shared, from the California Department of Social Services. I'll pass it over to Richard.
Thanks, Ashley. Good morning, everybody. I'm a consultant and trainer working with the department and their partners on System of Care and some related functions. So really happy to be with you this morning again for our monthly TA webinar, and I'll send it over to Diana Wagner.
Hi, Diana Wagner, and I'm with California Department of Social Services with the Continuum of Care Reform Branch. And thank you all for being here this morning. We welcome and hope you enjoy.
Excellent. Is that everybody from CDSS?
Yes, thank you, Nancy.
Yep, great. Thanks, Dana. Okay, how about Department of Healthcare Services? Lindsay, you want to start us off?
Yeah, sure, absolutely. Hi, this is Lindsay Merwin with Department of Healthcare Services. I work in the Behavioral Health Division, and I'm happy to be with you guys as part of the technical assistance team.
Anybody else from DHCS?
Yes, this is Tere Gonzalez. I am with the Medi-Cal Behavioral Health Division within DHCS. And then we have two other folks with DHCS as well that can introduce themselves.
Good morning, Paul Rosinski here from DHCS, Medi-Cal Behavioral Health Division. Happy to be here.
Thanks, Paul.
Good morning, this is Olivia Almaraz. I am also part of the System of Care TA team on the DHCS site, Behavioral Health Division as well. Welcome, everyone.
Thanks, Olivia. Okay, from the Department of Rehabilitation, Shanti, would you like to introduce yourself?
Hi, good morning. My name is Shanti Ezrin. I am with the Department of Rehabilitation's policy section. Very happy to be with everyone this morning. Thank you.
Glad you're here, Shanti. Okay, how about Christine, Department of Developmental Services?
Hey there, good morning, welcome. I'm Christine Bagley from the Department of Developmental Services. I work in our safety net unit, and as a part of that safety net unit, specifically, I am working to implement system of care with our regional center partners. Thanks.
And last but not least, we've got the Department of Education.
Hi, this is Renzo Bernalis with CDE. I work in the Integrated Services and Supports Office, which oversees the Foster Youth Coordinating Program, and I'm a member of the State Technical Assistance Team. Thank you for joining us today.
Excellent. Okay, so I'm going to throw up another another polling question. This one we've got, what role is your position? So we've got program, policy, data, or if you have overlapping or multiple roles. Awesome, thank you everyone. We're gonna keep it open for another 5 seconds. And this information is helpful for us to know who is attending these webinars. That helps us better make sure that we're providing the information that you all would like to have. I'm going to end the polling question. Here we go. I'm going to share the results. So you can see we've got a lot of program folks here, some policy, some data, but then people who obviously overlap multiple roles. Great. Okay, so we're going to get this started. Today, you can see our agenda for the call. We've already done introductions. We're going to move into some system of care updates to provide for everyone. We're going to then really have a good conversation about data and information sharing, the background and context. We're going to have a presentation from the California Department of Education and the California Department of Social Services, And then we're going to have an extended period of, probably an extended period of time, a little bit longer than normal for questions and answers as they come up. Let's see, we've got a few more polling questions we'd like to ask for everybody today. We've got, let me find it here really quickly. We would like your information on which parts of the MOU would you like more support or information on? So this will again help us in the future, but what would you like some more support on? And you can select all that apply. There's a lot of words there, so this one might take a little minute. So I can see, obviously, the results as they're coming in, and I'll share them here after everybody has answered, but it looks like all of the topics are getting some interest. I'll give you another second. People are still answering. Thanks for calling in today, Kurt. Okay, I'm going to end the polling so everybody can see the results. Information and data sharing was definitely a big topic last month. So you can see, can everybody see those results? Ashley, you can see the results? Awesome, great. Perfect. So you can see information, data sharing, alignment and coordination of services. So the system of care team will use this to help inform where to go next. I'm going to stop this and I'm going to ask one more polling question, which
And
is,
Nancy?
Yeah.
Sorry, I do just want to remind everybody that in regards to the
Uh-oh. Diana?
You're on mute,
Diana, you there?
Can you hear me now?
Now we can, yep.
I don't know what I touched, but we did have a webinar, I believe in July, that was on fiscal resource sharing. And so I'd also invite people to go onto our HHS website and watch that webinar or look through that PowerPoint.
Awesome, excellent, thank you. That's great recommendation. Yes, it was great. It was a great webinar if you missed it. Can get more information. Awesome. So here's another polling question I'm going to ask everybody to complete. And that is, what of the past two have been most helpful? And that, again, will help us make sure where we're hitting the target spot. Diana, they're asking for the link to the webinar in the chat room. Chat window. Is it a room or is it a window?
Yeah. We will have that link multiple times actually during the presentation for the California Health and Human Service Agency website.
Great.
And for those that missed of those webinars, you can see this list as an opportunity to find the webinars that will be, if they aren't already, they will be posted on the agency website also.
Excellent. Okay, this one is still getting answered. I'm going to end the polling here in just a minute. And I'll share the results here. Okay, so the past most helpful have been the overview. So that's good. That's good information to know. Information and data sharing. Excellent. And that makes sense. Financial resource management was probably targeted to a group of people. So good. Any thoughts about that system of care team? Ready to move on?
This is Christine. I think it's really neat to see that people enjoyed the open forum. So That's, I think, good feedback for us to hear. So thanks for sharing that.
Great. Excellent. Okay, so we are going to move on to updates. The first update I'm going to let everybody know of for the System of Care webinar that we're doing is probably many of you were familiar when you registered for this webinar that you were able to register as a series. And it was a little bit wonky in how your calendar invites worked with Outlook. The integration was a little bit wonky. Well, it turns out we've had some more glitches with the series way that we've created these webinars. So we're going to actually change, and we're going to just send out an individual link for every month that we do the webinar. So the links will change, but it will be much more easily integrated into your Outlook calendar system. And you will get notices if there's a change or an update to that link, or if there's a change or an update to that webinar. So just watch out for more information on that. We'll send you more invites, and you'll see, a register here. So if you've already registered for the series, you will need to re-register. And we will make that clear. You'll need to re-register. So sorry for the hassle in making you re-register for these things, but I think everybody will be happier with the series format that we've had. And the dates have changed a couple of times just through the Zoom technology, not intentional on our part. So just be on the lookout for that. And then with that, I'm going to pass this over to the California Department of Social Services. Daniel, are you going to kick us off with some updates today?
Sure. Good morning, everyone. My name is Daniel Wilson with the California Department of Social Services. So I just have a couple of updates about California Wraparound and some work around peer partners that we've been focused on. So regarding Wraparound, we have a few opportunities for statewide system of care involvement in Wraparound. The first is our California Wraparound Advisory Committee, which meets quarterly, and it's an opportunity for folks, both providers and counties, state level folks across systems to come together. And we usually have some facilitated opportunities for advisory around Wraparound, as well as some group discussions. At our past CWAC meeting, we had some discussions around racial equity within Wraparound, and also obtaining some feedback around Wraparound trainings that are needed. And we had some discussion about our Wraparound Steering Committee, which is the next piece of my update. So we've convened a Wraparound Steering Committee, which has representatives from across the state, from providers, from different system partners, child welfare, probation, behavioral health, and parent representation and youth representation to inform really Wraparound, and taking a look at Wraparound. What do we need to do to revitalize, rejuvenate Wraparound to ensure that Wraparound practices around the state and programs are high fidelity and consistent throughout the state. And the Wraparound Steering Committee team is meeting monthly, and we're pretty much at the beginning, and a lot of the updates from the steering committee are passed through the California Wraparound Advisory Committee meeting, which is an open meeting that anyone can join. And then we also have the California Wraparound hubs that have been in existence for quite some time. And the Wraparound hubs are regional. There's 3, and they meet quarterly as well. And it's an opportunity for Wraparound practitioners, parent partners, youth partners, program administrators to come together, and really they set their own agendas at the hub meetings. So it varies from region to region. So those are all opportunities to get more involved in Wraparound and provide feedback through that system. And I will provide registration information for the California Wraparound hubs, the regional hubs, and the California Wraparound Advisory Committee in the chat feature. We also have recently formed in conjunction with UC Davis Resource Center for Family Focused Practice, in addition to all of our wraparound work with them, peer partner hubs. And the peer partner hubs, there are, I believe, 5 regional hubs, and they're structured where we're all in one big webinar together, and then we break out into breakout rooms. And really the purpose of the peer partner hubs is for folks with lived experience from any system who are now serving in the capacity as a youth or parent mentor or a partner or advocate, who support folks who are currently moving through one of our respective systems to provide mentoring and partnership support through that, who have lived experience themselves. And those also are quarterly. And a lot of the agendas is set around, and the goal and the purpose of the peer partner hubs is for peer support to one another, to advocate needs and need for resources through to their respective agencies, to CDSS and our respective departments, and some opportunities for continued training for peer partners. So I will paste the registration information for that in the chat feature as well. And a lot of that information feeds up into our parent partner advisory committee and other peer partner groups within CDSS. So a lot of the chairs of the peer partner hubs are from our parent partner advisory committee, and we have a lot of participation from California Youth Connection and the Youth Engagement Project, which are youth advocacy organizations run for and by former foster youth. So if you have any questions, feel free to reach out to us. Our contact information is included in the links that I posted in the chat feature, so you can email us there. You can send me a message on Zoom right now if you'd like, and feel free to visit the website for more information and to register for any of our wraparound or peer partner opportunities.
Awesome. Thanks, Daniel. There's some really great stuff going on. I hope everybody can join in. So thank you for those great updates. And Ashley, did you have a couple?
Yep, I think we're ready to pass to
You're
Christine.
good. Okay. All right, Christine.
Hey there. So I wanted to just share some information about Early Start. I had shared some information about Early Start referrals kind of being impacted by COVID-19, and Early Start in partnership with the California Department of Education and stakeholders has created kind of 2 infographics to kind of help spread the word about Early Start still being open and available and accepting referrals. And so one of the infographics kind of displays the kind of community, almost the Early Start system of care of how Early Start touches and works with in coordination with multiple partners. And then the other one is kind of a infographic that explains what Early Start is all about and how individuals are eligible and whatnot. So I'm gonna share those out with everybody, and you can just kind of add that to your toolbox as you're having discussions with, colleagues or, community partners, families. So just trying to really get the word out that we're making sure that we're making all the referrals we can that are appropriate to get those little kiddos the services they need. So I'm going to work to get those files in linked here in the chat in some way. So thanks.
Awesome. Thanks, Christine. Okay, so with that, I think we are finished with our system of care updates. And Ashley, I'm going to turn this over to you.
Thank you. Part of Assembly Bill 2083 includes the deliverables on this slide. Our monthly webinars, such as the one we're on today, are part of the technical assistance called for in that legislation. The Children and Youth System of Care State Technical Assistance Team, the folks that you met just a moment ago, are also working on the gaps analysis and continuum of care mentioned in the slide, and actually maybe posted to the California Health and Human Service Agency website soon, along with a plan for increasing capacity and addressing gaps. You can check out the California Health and Human Service Agency website for more information at chhs.ca.gov. You'll see that on some slides coming up, and we can post it in the chat again as well. We will move to the next slide, please. Many of you have joined us for some or all of the monthly webinars on system of care topics and are familiar already with AB 2083. We just talked about the deliverables from the legislation, and here's a few more details along with a link to the California Health and Human Service Agency website for accessing more information. AB 2083 requires each county to develop and implement an MOU to outline the roles and responsibilities of the public programs that serve children and their families in foster care. This effort is in recognition that our collective obligation to ensure that services we provide are coordinated, timely, and trauma-informed, and that the culture of our programs and services are person-centered. The work and the message from agency and state leadership provides a reminder that these are our collective children and they all deserve the very best. And that is what our work here is about. Next slide, please. Thank you. So this is a snapshot, a visual of the team providing these monthly TA webinars, the group that introduced themselves. We are all part of the Children and Youth System of Care State Technical Assistance Team. There's members from each of the departments listed there, the California Department of Developmental Services, regional centers, the Department of Health Care Services, Department of Social Services, and Department of Education, as well as Department of Rehabilitation. And members from these departments and our team work with State Department leadership and stakeholders in this effort. And I'm going to hand it over to Lindsay now to walk through the next bit of information we hope to share.
Thank you, Ashley. So the California Health and Human Services Agency, along with stakeholders, has identified the mission of Child and Youth System of Care Technical System State Team to be promoting collaboration and communication across systems to meet the needs of children, youth, and families, supporting timely access to trauma-informed services for children and youth, resolving technical assistance requests by counties and partner agencies as requested to meet the needs of the children and youth. Next slide, please.
Sorry, Lindsay, is this the right slide?
Yeah, you're great. Okay. You're great. So our previous presentation focused on youth, client, student level information sharing for care and service coordination. And today's presentation and content will focus on data sharing between county agencies and other children and youth system of care partners. And I will pass it to Richard for the next slide.
Appreciate that. And thanks, Nancy, for advancing. Let's dig in, shall we, to the nitty-gritty of data sharing. And as Lindsay mentioned, today's content is really about the macro data, the organizational data that informs policy and management and practice. It's not the information sharing that we talked about last month that is very youth or student specific. So we want to draw a clear distinction that this data is really a different type of data than what we talked about last month. The sharing of information at the organizational level, the system level, is a really complex task. It's one of 3 or 4 portions of your local memorandum of understanding that will really challenge you, most likely. And that's okay. It should. There's some complexity to it. because in part, information sharing and data sharing mean different things to each partner, right? We make this really complex in government because there are lots of federal and state rules that apply. And so it's just really difficult to navigate it. What's important to recognize is that the alignment that the MOU and that system of care really invite of us is the place where that MOU is really the place where we can begin to articulate the alignment so that we can navigate the barriers and the complexities so that we can better share information. To that end, the information from last month's presentation and this month's presentation really needs to be communicated to the individuals within your local systems of care, your interagency leadership team personnel, your program managers who are informing and supporting the MOU specifically. So if you're not a person that's connected to that, if you'll be a messenger locally, and just make sure that once this information is available, that the PowerPoints are posted, that you do your best to engage your partners at whatever level of the organization you're in so that they have access to these resources. That would be super helpful. Next slide. It's the sharing of organizational data that really allows partners to begin to do what the integrated core practice model suggests is a monitoring and adapting process. While we do that monitoring and adapting of the service plan for every young person in care, we have a parallel obligation to monitor and adapt our programs and our policies so that we can be effective as a system, right? In other words, data sharing is really foundational to children's system of care improvement. It is the process by which we collectively begin to answer the question, how will we know we're doing the right thing, right? So both effectiveness of program questions can be answered, and ultimately we begin through the sharing of data to really identify where we can impact the critical things like racial disproportionality, overrepresentation, or underutilization in our systems. Those questions of justice and equity that are so paramount to the conversations we're having today in children's welfare and related services. Unless we can effectively share that information, we'll really struggle to get to those fundamental solutions that are necessary to adapt our systems, to improve our systems, so that we can actually change those outcomes, if you will. Without sharing of outcome data, it's really difficult to determine the impact which our organizations are having. And we'll talk about this a couple of times as we go forward. Next slide. So we want to spend a few minutes on this, on these ideas. It's critical to recognize that when we're in a memorandum of understanding that links us into a collective system, a large S system of care, if you will, the impacts to the system are often found in the outcomes of other partners. Our efforts are often redundant because we've lived in silos up until this point in California. Many of the monitoring processes, the accountability processes, the compliance processes have data points in them. Many of you routinely do this, right? You have a report that's due on an annual basis or a triannual basis, or you have some other report that's due to the state or federal government or to a funder. When we're in alignment with our partners, we begin to see the redundancies that are in those systems, and we recognize where we can actually link data points to better inform the qualitative and quantitative outcomes that are necessary to save fiscal and personnel resources. And when we do that, we can begin to invest in savings upstream, if you will. We can reinvest the dollars that we're spending in those redundant quality management processes in ways that actually impact young people in the system. Every single fiscal source that you have within your own agency or department likely has some type of accountability process. The examples that come to mind are in child welfare and probation, you have a CSFR or system improvement planning process that requires a reporting element. If you're in the mental health plan or the behavioral health world, you have an EQRO or external quality review organization that comes on site or that visits your program and audits your program every year, in addition to a triannual review process. If you're in the foster youth support through schools, you have an LCAP process, right? The local control accountability process. All of these are examples of the various reports that you have to produce. And within each of those reports, there are data points. And what we're really talking about in a system of care is how do we connect those data points to learn from one another to inform the whole system, and where in that process might we actually save some resources that we could invest in other places. So all of this really can inform additionally the kind of asset mapping or gaps analysis that might be required when you implement new programs. So many of you will be involved in the coming months in the family urgent response system design and development. Sometime in 2021 and the years beyond, many of you will be impacted by Family First Prevention Services Act. These are just two examples that come to mind of where you're going to have to do some assessment organizationally to know how to implement those new programs and new funding sources. And this collective approach to the asset mapping to determining what your community and county and your system needs are will be critical. So we just can't overemphasize enough the value, even though it's complex and it's challenging work and will require an investment of time and energy. The benefit to this is significant to the system. Next slide. So this particular slide should be familiar to some of you if you've joined us before, as we've talked about interagency leadership and how the tapestry of connectivity forms around a system of care. The data points and the outcomes for each partner can and should be linked to then inform. If you look at the blue vertical columns representing the potential members of your system of care who are obligated to interagency leadership and to the MOU, by effectively linking the outcomes, outputs, and other kind of organizational data points, then collectively you can begin then to recognize where we want to shape local policy, right? And where our leadership decisions can be best informed. Those in turn cascading down the yellow lines, those policy and leadership decisions in that direction and vision impact how management measures, further measures and impacts program, right? And the practice level, ultimately cascading right down to where community partners and direct service personnel impact the lives of young people and families in our systems. When you think about the research on collective impact of the last 20, 25 years that comes out of Stanford and other places, this is the connectivity of organizational data that's required to measure collective impact. You can't really do it otherwise. And there are some fantastic examples which we'll take a look at, both kind of at the county level and then the state level in our resource conversation a little bit later. So let me yield to Christine, and then we'll come back to some examples.
Thanks, Richard. So we'll move to the next slide. Thanks, Nancy. So I think this is a kind of probably a repeat of a slide from last month, but I think it's an important slide to point out. You know, it's the ever-pressing dilemma where you know, as providers, we are really have to be accountable for honoring confidentiality and the privacy of the individuals that we're serving. At the same time, we're obligated to deliver timely and effective care coordination. And so we often see those two things in kind of pressing against one another. And I think we get kind of bogged down in that sometimes and sit in that space rather than kind of move us forward to what we're talking about today, which is that kind of higher level system data. So just important to kind of, you know, acknowledge that, but then also kind of put that in its place and then focus on our conversation today, which is the kind of system level data sharing. So next slide. So system of care is an opportunity for us to understand how our systems are effective and how we can kind of look at and participate in constantly improving our outcomes for the youth that we're serving. But in order to do that, it really requires us to make data informed decisions about our kind of programmatic planning. And that requires sharing data. How do you make a decision about where you're going to invest something, or how you can reshape or align or integrate with your system partners in the absence of really having, you know, that concrete information from each other's systems? You know, to Richard's point, he had mentioned, you know, the focus on justice and equity. And I think that's a really good example of sharing that information opens up opportunities to understand where there's potential gaps within our various systems, but also where there's opportunities to come into alignment so that you can make policy and programmatic decisions to kind of move you forward. Next slide. This slide is just an example. You know, Richard had already kind of touched on this as well, is that there are already you know, accountability and reporting requirement information out there. We're all generating reports. We're accountable to report to the feds or the states, and so there's kind of, you know, concrete data that's already out there being shared. And so, you know, again, back to Richard's point, that kind of mapping activity, like what do we already have information on? What's already available to share? How can we integrate that or leverage that information? And so this is just an example of some of those existing accountability and reporting requirements, that tools that are already readily available to you guys. Next slide. And I'll pass it back to Richard.
Thanks, Christine.
Mhm.
What's really, what the insight I just had while Christine was talking there, if you look back at that list, is that much of that's public data, right? It's public facing data. And so while we talk about the need often for data sharing agreements, on some level, it's often not necessary to even have those kinds of agreements if we just begin to look at what is already produced by way of data and it's public facing, right? We just need to understand each other's systems. Let's look at a couple of examples locally, which we think are illustrative of this idea of monitoring and adapting or building programs based upon the needs of the collective and not just from a singular perspective. So we're going to share a couple of ideas, one from Placer and one from San Diego, with their awareness that kind of illustrate this. So in Placer County, about 10 or 12 years ago now, they developed what they call the Crisis Resolution Center. It is funded with state probation dollars. These are Juvenile Justice Crime Prevention Act and Youth Offender Block Grant monies. And in 2018, the latest year for which their annual reporting is fully complete, they served 86 youth who were referred by law enforcement, schools, and other systems. So the first point to recognize is that these are state probation dollars, but they're serving youth from other systems. Now, those kids have to be at risk, right, of entry to probation by definition, but the program design takes care of that. Once they're referred to the Crisis Resolution Center, they spend an average of about 2 weeks in what is a 24-hour crisis residential service. So these are not kids in welfare or probation systems. They're not adjudicated. They're pre-system kids in that sense, right? And once they're there, they're connected to and receive with their family members intensive family therapy and long-term aftercare. Let's back up, Nancy, if we can.
Sorry, Richard, I hit something. I'm not, what slide?
Got to go
Where do I
way
need to go?
back.
Sorry, what slide should we be on?
No, mine are not numbered, but it's
14 or 15.
Okay,
Thanks, Rachel.
sorry. I hit my mouse and the wheel
Yeah.
just spun.
There we go.
There we go. Sorry.
There we go. And they're enrolled in not only intensive family therapy for a relatively brief period of time, but long-term aftercare. So it's an entry to system-wide services, and that intensive family therapy and that aftercare is coordinated with other systems in the county. And here's the point to make, right? Only when they connect their outcomes and talk about those across the system do they recognize that they've diverted successfully 94% of the young people who would otherwise be touching one of the other county systems. So these are high-risk young people who would be penetrating the welfare, behavioral health, probation systems, or deep end special education systems. And they're estimating in 2018, again, a cost savings in local county and state dollars of almost $2 million. We've got a link here to the provider report, which we won't go to now. That's the report from the contractor that delivers this service for Placer. And it's a good example of where connecting the data points allows the system to see its collective master impact, if you will. Let's do another example. Next slide from San Diego. This is one that's more kind of universal. And I want to suggest that this kind of sharing is already present in many counties, right? So this comes from San Diego County's Mental Health Services Act report. And within San Diego County's MHSA, Mental Health Services Act plan and service delivery, they've got many programs. This is just 3 of them, okay? But these are the 3 that in a quick analysis have a very specific impact upon other systems kids, if you will, okay? So the full service partnership, some form of wraparound in San Diego County. If you look at where their referrals come from, just think about, then this is language that comes straight out of their report. All right, so these are kids that are at high risk of or already in parallel systems, but they are being served by the Mental Health Services Act. Specific to their child welfare population, they have a program called Incredible Families that delivers outpatient mental health treatment and supports to families involved in child welfare. Ideally then, reducing the length of stay in child welfare, or in some cases, potentially diverting from child welfare, depending upon how the county uses those dollars. Very specific to the probation department, the full service partnership and assertive community treatment program strengthens collaboration with the frontline law enforcement, right? So that the individuals with severe mental illness get timely, compassionate care through MHSA. And the impact, you can imagine the impact on the probation department for those individuals getting effective care, right? Fewer people, young people or young adults in demand for services because the criminogenic factors are going to be positively impacted by getting good care through MHSA. So these are just quick examples really of where the systems can be connected in terms of their back end monitoring and adapting so that you can maximize the impact of being in a system of care together. Let's go to the next slide and talk about briefly the guidance that's in the agency, the statewide toolkit, and we've linked it with a hyperlink here. This comes from the Assembly Bill 23 guidance. And this first reference suggests that system partners, those of you who have agencies that are part of your interagency leadership and your memorandum of understanding, are to the fullest extent allowed by law to share necessary and relevant client-specific information in order to conduct the various services that you deliver, right? And to coordinate that care. I think we want to suggest with this language that this is like the minimum expectation, all right? So if nothing else, your MOU should contain something like this that says, look, we're committed to it. I want to suggest that there's not enough detail in this particular paragraph. If this is all that's in your MOU, it gives you permission to share information. It says we're going to do it, but it may not be sufficient to talk about actually how you're going to execute that. So this will be the minimum expectation, I think, for an MOU. Next slide. Here we begin to get, and this again from the guidance at the state level that comes from the toolkit, we begin to get more specific about the kind of allowances for interagency sharing that are possible. Those allowances, when they're executed properly, allow us to eliminate barriers, to reduce placement, to increase and improve services, et cetera. So this is just a further elaboration on this idea that you're authorized to do this. This is the language from the law or close to it. So it says basically your partner systems may disclose and exchange information with one another. Next slide. So as you're thinking about this component of your memorandum of understanding, and this is element 3, I think. The MOU should really endow a number of things. In order to do that, you're going to have a way to kind of introduce and connect the organizational improvement efforts that we've been talking about through your various own individual department level systems. So you have analysts who are responsible for helping you generate the reports, or maybe that's you if you're a supervisor or manager. But you're going to want to connect those folks. And I want to suggest that some of this connection might best be done informally. I think back to my experience in the county system where we had a relatively firm but informal agreement that folks were going to go to lunch or breakfast pretty often, on a monthly basis or quarterly basis. And over that time together, talk about where their roles or duties impacted the system. And if you were a data person, that was the topic of the conversation, right? So it's important that as you think about designing your MOU, how are we going to connect and introduce the various analysts and professionals who are responsible for managing the data and the quality management processes? Once they're connected to each other and they know each other, then some level of analysis or meta-analysis is necessary, right? To begin to crosswalk, where does this data touch systems across the various partners within the MOU, right? So where are our compliance processes connected? And that's where you'll begin to identify where there could be cost savings for yourself within a system. Once that process is done, then you may discover that you need to execute data sharing agreements to get more definitive, more specific, more explicit about how that data will be used. But again, sometimes that's not even necessary because you've got public data that each of your departments uses. And it's a good place to start just by merging that public data and talking about it together. Finally, it's important to kind of hold each other to a shared accountability. That's best done in relationship, right? So back to point number 1, by having a trust-based interagency relationship, then we can begin to see ourselves in shared accountability to our young people and the families who know and love them. Along those lines, the more champions you can develop for data management and sharing of data, the better. One department alone can't champion this effort. So really want to encourage authentic partnership, the genuine owning or stewarding of a commitment, if you will, towards the sharing of data. When you craft your MOU around data sharing, don't let perfect be the enemy of the good. It may take a number of years to really work through the detail of MOU information sharing, based information sharing. It's going to require some work on the part of your risk management personnel and your local county council or legal attorneys, right? Those folks will have to ultimately sign off on these kinds of agreements. So don't let that often difficult and bureaucratic process be an obstacle to some meaningful early work around sharing of information. Next slide. Some additional thoughts around sharing of data within your MOU. The interagency leadership team can do much to really set the vision for this. So by making an interagency leadership team agenda on a monthly basis, or whenever your interagency leadership team meeting is going to take place, by agendizing into that conversation data and outcomes, you'll begin to prime the pump, if you will, that we see the world in our local system from a data-driven lens. Only when senior leaders ask for this information continuously and hold one another to bringing the information forward will that process really start to become the culture of the collective, if you will. So again, every interagency leadership team meeting is an opportunity to bring forward a report or to bring forward an outcome data point and talk about it with partners so that we can begin to see each other and where our systems are touching as well. We've already talked about the second bullet, which is to build the capacity of analysts and quality managers. What this really invites is cross-training, right? So if you're a data analyst in the probation department and you have a finite set of duties there, right? Orienting to what the child welfare analyst or the child welfare system improvement planning process looks like is going to be critical. Likewise, understanding what the mental health plan and what the regional centers and what schools all have to do on some level will greatly expand your capacity to connect the data on the back end so that we really start to mature the impact, if you will. When we're really attentive to this, what will emerge, and some of your county and regional center partners have begun to think about this, is you can craft, once you're connecting this back-end data, you can craft what you might consider a system of care dashboard. And this is nothing more than a set of kind of agreed to outcome points, right? What are the data points that we're going to look at collectively amongst our partners that will evaluate twice a year or once a year to begin to answer that question around how do we know our system is working? Would strongly encourage you to think about what your dashboard should look like. And there are some examples. There's a hyperlink here to a statewide dashboard. It's much deeper and broader than the kind of dashboard you'll probably want for a local system of care, but it's a great place to look. While I'm thinking about that, another great place to look, which we didn't put in our resource slides, is the Robert Wood Johnson County Wellbeing Outcomes. Most of you are familiar or could be familiar with Robert Wood Johnson. They do an annual report of well-being for children and families in California, and they put out a nice report. It's on the web. You can Google Robert Wood Johnson, Google your county, and you'll get your report. That's a fantastic dashboard. And you could go there to get some inspiration for what your system of care dashboard might look like as well. And with that, I think I'm going to yield to Renzo, who's going to introduce our guests for our statewide presentation today.
Thank you, Richard. So Richard talked about looking for opportunities to interconnect data at the local level. And the presenters that we're going to hear from today are going to share activities that take place between the California Department of Social Services and the California Department of Education to match foster youth student information across both of our systems. What should be noted about this is that in order for this function to happen, the CDSS, used an acronym, the California Department of Social Services and the California Department of Education had to collaborate to write a data use agreement that was approved by both agencies in order to authorize the actions that take place. The actions that occur through the data sharing agreement are specifically for programmatic needs that exist within both of our departments, including a connection to the local control funding formula. But once that information is matched, that information is also made available at the local level through our county offices of education. So without a further ado, I'd like to introduce Liberty Van Natten from the California Department of Education and Alicia Sandoval from the California Department of Social Services.
Thank you, Renzo. So my name is Liberty Van Atten, as he mentioned. I am with the California Department of Education, and I serve as the Foster Youth Data Liaison.
Good morning, everyone. Alicia Sandoval with the California Department of Social Services. I work in our Child Welfare Systems branch, and I am the Data Management Service Manager. Happy to be joining all of you.
Okay, let's go to the next slide, please. So today, our presentation is really for us to share with you our universal data sharing agreement that Renzo mentioned, that is between the California Department of Social Services and the California Department of Education. So part of all of that is we're going to begin by just discussing the purpose and the need. So why we have this MOU and what purpose does it serve? And then we're going to dig into what actually the UDSA is. We're going to share some of the collaboration processes that we engaged in and some of the really great successes that we found along the way. We're also going to discuss some of the challenges, because were also really important things to learn as well. And then we're going to dig into what the actual final MOU contains, and then discuss what an example of a data exchange that is covered under that MOU. Next slide, please. So this is kind of our disclaimer slide, just to let folks know that this is really just to serve as information. Neither Alicia nor myself, neither of us are attorneys. This is not meant to be, legal advice per se. We just really want to share how we did this, the process that we went through, and how it really serves to meet our specific needs. Another thing to keep in mind is that this MOU is between only two entities. It's between Department of Education and Department of Social Services. So that's just another caveat, I guess I could say. And then it's not meant to serve as a sample for folks to follow for a number of different reasons. This is really the work that you will do on the local level. But I think that our example here is an example of a flexible approach that can be adapted and used in a variety of different instances. Next slide, please. So the UDSA, the Universal Data Sharing Agreement, it was really designed to serve some of our current needs, but is also one of the big purposes of it was to be able to take in future needs of data sharing between our two agencies. So for foster youth, for example, their Department of Education and Department of Social Services, there are shared kids, so to speak. And so we have some existing needs right now, but we also wanted to have a process whereby things that may come down the pike in the future, questions that we want answered or new legislation, these are the things that we really want this UDSA to be able to handle as they come along. It also was really important and critical that we made that this UDSA is a way to share data in a timely and in a secure process. So very, very safe and secure. And again, back to that idea of being flexible. So it was really, as two state agencies that serve the same group of kids many times, coming up with agreements, as Richard was discussing, it can be complicated and take a lot of time. And so the idea was that this UDSA is really flexible to adapt to our needs so that we can avoid amendments. And we'll get into that and how it actually works later on. But the idea is that we can incorporate new things into it without having to amend a larger MOU, if that makes sense. And then it's evergreen, so that it is always changing as we need it to change. Next slide, please. So the UDSA there's two different kind of sections of it, so to speak. And on the left is a group of things that are covered under the UDSA itself. It really serves as a high level data sharing agreement. So it's it's that umbrella, that image that we showed earlier. So it's sharing that meets both our agency's security and legal parameters. So both agencies are good with this from our legal perspective. It serves as an umbrella over smaller individual data sharing exchanges. So those are those more flexible use cases that we can add under the UDSA without amending the actual MOU. The UDSA, again, it's really high level. It doesn't include specs or details of the actual data itself. It also is a place where we can discuss how we de-identify the data. So that's kind of gets back into that whole security thing. So that high level UDSA is the umbrella. Under that is what we have in the column on the right. Those are, we call them DEPs or data exchange projects. And these are individual projects where it's covered under the security provisions of that larger MOU. But these are single use cases. So we're going to dig in and show you an example of an actual DEP of a single use case that we have between our agencies under this larger MOU. But the DEPs, or these data exchange projects, these are the places where we actually show the data specs. We go into the details about how the data are shared. And it's also a really great place and important that we include information on the purpose of the sharing of the data. So why are we sharing the data? Next slide, please. I'm still seeing the old slide. There it is. Perfect. Thank you. So when we put together the UDSA, I think it's interesting because I think it was my second day on the job at CDE, and suddenly this thing was just starting and getting underway. And so for me, it's really interesting that I can kind of reflect back on it as an entirely new learning experience. And so some of these things about how we created it are things that we learned along the way, but things that we also did intentionally. So, but these are things that really point to some of the really big successes. One of the most important things about this process and how we came together to this big agreement between our agencies was that we did it through collaboration. And we kind of had different teams who met at different times and in different configurations of folks. But the people or the org chart stuff, the stuff listed on the left, these are really important people that we found at different points in time really need to be part of the conversation. Sometimes it's everyone, sometimes it's just a few. So for example, the data folks really need to be in on this in order to talk to how the data are accessed and what is a realistic data that can be pulled and shared. Those data folks would talk to legal, because legal might say, well, we can't share that because that's PII, but and so those are the types of really cross collaboration that has to happen. And then that collaboration across the agencies from those entities was also really important. So having your data folks, including them, I think these are the things that Richard was also kind of touching on as well. The legal folks, of course, is essential. Your contracts department or division, sometimes that's part of your legal, it may not be. Your privacy officer, if you have one. Your research team, if you have somebody who's doing research. So these are the people who can talk to the data folks and say, yeah, if we have this data and we have these questions, we could answer a bunch of really interesting things that we aren't able to see yet. And also equally important is to have your program folks who know what a data point actually means on the ground, so to speak. The technology people are really essential to have. And then it's also, I think, really important to have a point person at each agency. That way, we don't get, things don't get lost in email, so to speak, or, oh, I thought you had it and you had it. And it's just that having that designated point of contact was also really important. And then as far as collaboration itself, regular meetings are important to have. We did this on a really fast turnaround, I guess, regarding, I think it took about 2 months, Alicia, for us to get it finalized. From a state agency MOU perspective, that's pretty quick. we did that through regular meetings. We were meeting all the time. And so we also had a shared location for documents and resources. So I think we used SharePoint. There's a lot of different platforms that can be used, but having that central location where everybody's it kind of creates version control, so to speak, and everybody's working off the most recent thing. That's also a really important strategy. And then we actually, many times we sat down and did real-time writing and editing in person, in the same room, or virtually now. And that was really helpful, because I think sometimes when we share text back via email, things can get kind of lost in translation, but the opportunity to write things in real time and discuss and hash out and clarify was really valuable. So these are just some of our really high level successes. Next slide, please. Of course, there were challenges along the way. And I think many of you may relate to this as we talk about cross-agency collaboration. There are different organizational cultures. These are things that, you have to come to this experience knowing that you don't know how their organization functions, or trying to turn off those assumptions that you may have. Being aware of these different organizational cultures is a great place to start, though. We also have different approaches to data sharing. So we, at Department of Education, we have FERPA regulations, for example. Social services may have HIPAA. And so those different approaches govern how and what we can share regarding data. Of course, there are different perspectives of the team. Someone might think we can use it for this, and someone say, no, we need to do it for that. Those different perspectives can slow things down, but being aware of them is also really just important. Big picture and details. These were things that sometimes there's miscommunications, and I think those miscommunications can also show up as different priorities and different timelines. So keeping in mind all of these things, these are just things that we encountered, we addressed, we overcame them, but they did create challenges along the way. Next slide, please.
So as Liberty mentioned, the Universal Data Sharing Agreement is the umbrella agreement. And I want to talk a little bit more about the specific data exchange projects, which are those single use agreements. And this slide shows some data exchange projects that have either been approved or they're in the queue. And we'll provide more details on the foster youth match process in a little bit. Next slide, please. So the DEPs are created so that we can exchange data for specific use cases. And we created a DEP template that's part of that larger umbrella agreement. These DEPs can either be a one-way or bi-directional data exchange, depending on the data needs of our organizations. And all of the use cases are covered under the provisions of that larger umbrella agreement. Next slide, please. So I want to provide you with details that are included in those DEPs. Our departments agreed on these specific categories, and which cannot change. And the DEP template is actually part of the umbrella agreement. So first, title and summary of project. It's really just a short description of what the DEP entails. And then we have a timeline, which should include the beginning and ending dates for the project. And then we have statutory authority, and this is really important. We need to make sure that we include a federal or state statute or regulation requiring or authorizing the data exchange. And then we have a purpose statement, which is basically a description of what is intended to be achieved through the DEP and how results will benefit either CDE or CDSS. Next slide, please. Okay, so next is data systems and storage. So we need to identify which system will be generating the data and the location of where the data will be stored. So for example, a cloud infrastructure or an on-premise server. And then the data file parameters and data elements. We need a description of the data files. So the population, the data elements required for the data exchange, that kind of thing. And then the data exchange schedule. So we need specific dates, maybe even times, frequencies that the data will be provided. And the data exchange method, we want to include that as well. SFTP is an example of that. And then the data match. What we need to make sure that we're aware of is, will the data be matched with other data sets? And this could include publicly available data as well. Next slide, please.
So another really important thing that we included in the DEP template was a place for to articulate any public disclosures that may be a result of the data that is shared. Then after that is a place where you can discuss whether or not there will be a review and approval process. So for example, if CDSS is giving CDE foster youth data, CDSS, we have built in a place where CDSS can say, hey, we want to review that and we want to just make sure that it aligns with our understanding, for example. So that is a really important piece to include in the exchange project. And then another important section is just who is authorized to access this. So we're talking, who are the contractors, consultants, or vendors? For example, in education, educational testing services, ETS, they are our contracted vendor to administer our statewide student assessment. And so our contractors, do they have access to this data, for example? Another authorized access to think about is researchers. So will any researchers be accessing this information, or any other entities? So these are things that when we are getting someone else's data, we want them to know who else is going to have it, right? And this is an important place, and we put it in 3 separate sections. I think because they are different entities for one, but also I think there are different laws that govern who can access what and under what provisions, so to speak. And so we separated those out in this data exchange project template. And then whether or not there are any additional compliance requirements. This is just kind of like those use cases, the one-offs where, oh, this is that one scenario where if we're sharing X, we need to do Y. So just keeping it flexible is that last bullet there. Next slide, please. So the disposition, the data disposition is something that we, from an education perspective, really need to put in there because it's part of FERPA, and the acronym is spelled out. Thank you, Renzo, in the chat. In order to share educational data, we have to articulate how and when that data is going to be either destroyed or given back, so to speak. This next bullet as a recurring meeting schedule, this is that idea, I think, that Richard was talking about, whether it's formal or informal. This is a place where you can articulate, it's important for us to get together as collaborators to discuss this work. Even though we've come to an agreement, we still need a recurring meeting to discuss any changes or questions, to talk about the information across our agencies. So that's an important section to include in the data exchange project that we felt was important to put in there. And then, of course, a dispute resolution. So if there is a dispute, what's the process whereby that is resolved? And then any additional information, like always keep a place to have more other stuff that you may not think about, you know, that this is that flexibility, I think, that we were building in. And of course, I think we have it named as any additional project specific information that is not otherwise captured in this exchange. So, and then of course, who to contact. So the names of the people and the signatories. So these are all of the big buckets that are included in that data exchange project template. Next slide, please.
So this slide shows the flow of the DEP development and approval process. So first, the DEP template is generated by the agency that's requesting the data. That agency then works with their program staff, with privacy attorneys, contract staff, stakeholders, and they produce a final internal draft. So the next step, this draft is shared with the other agency, and then they also work with their partners and they provide feedback. So this next step is probably where we spent most of our time on this agreement. Our two departments, as Liberty mentioned, we met numerous times with our attorneys just to narrow down the language and solidify the specific data exchange details. And this is where I do agree that it was really helpful to have frequent scheduled times to meet, and also to be able to make those edits during the meetings to kind of speed that process up a bit. And then lastly, after both of our agencies agree on the language, we route the final DEP for signature and it's executed. And overall, I just want to say that this DEP process, which is the use case process, it really is fast and efficient, especially when comparing to our typical contract development state processes. So, so it really has worked out well for us. Next slide, please.
Sorry. So we wanted to share with you an actual example, not just of what a data exchange process is that we actually have going on, but also an example of data sharing that is really important, that I think everyone on this webinar would accesses or in some way benefits from. So the Foster Youth Match is one specific data exchange project that we have that is under the Universal Data Sharing Agreement. And at a high level, this is used to identify youth for the local control funding formula. It's also a place where our local education agencies, our schools and our districts can know who their foster youth are in order to provide them some specific educational rights that they are entitled to. And then additionally, in order to monitor the educational outcomes of foster youth, we have to identify them. And so this Foster Youth Match Data Exchange Project, it meets all of those needs. Next slide, please.
Okay, so because data that's related to children in the child welfare system are coming from two different sources that are not connected, and so those are the local student information systems and the county child welfare data system, we have to utilize what we call the foster youth match process. So first and foremost, it's important to remember that CDSS is the authoritative source for who is identified as a foster youth. And we want to really ensure that we're fully and accurately identifying all children so that schools are providing those additional supports and services. Students who are identified as children in the child welfare system by CDSS under that LCFF foster youth definition are matched with data in CalPADS, which is the CDE statewide system, on a weekly basis. And that information is then provided to the local education agencies. Without this match, we may not be identifying all foster youth in schools, particularly in a timely fashion. Next slide, please. Okay, so this slide shows the specific ed code that defines foster youth for LCFF. And when we talk about the foster youth match process, it's important to remember that we're only talking about foster youth who meet this definition. And this LCFF definition includes children who are living at home with an open child welfare case, as well as those children in foster care. It also includes children supervised by both child welfare and probation departments, and also older non-minor dependent youth that are enrolled in high school. And this definition also excludes some of our child welfare populations. It excludes voluntary placements, and it also excludes all non-dependent legal guardian placements. Next slide, please.
So as Alicia was kind of brought up, the foster youth match process really is required because data on foster youth exists in different systems. This is CalPADS, that state educational data system that Alicia mentioned. Data also come from County Child Welfare Services case management system. And then there is data that exists at our local educational level. This is our schools and districts across the state. And all three of these different buckets or systems have different actual data systems themselves. So this is a specific data system, CalPADS. Then CWS CMS is a different system. And then each district in the state may use a different student information system. So our local educational agencies use a variety of different systems to collect and store their educational data. But what's interesting is that as a state agency, CDE does not have access to these systems because there are so many different ones, I think primarily. So this is where attendance, grades, high school graduation, enrollment information, that's where this information lives. Information on foster youth who are in the child welfare system, this is in the CWS CMS data system, and this is our social workers enter this information. And then from a state perspective, the Department of Education has access to statewide educational outcome data. And it's this system where the foster match process takes place. So county social services, local educational data, those are matched within this system. And it's essentially so that our districts, our schools and districts can know who their foster youth are. Next slide, please. So, so CalPADS is that state system that I was talking about. It's the system where the data are matched and our schools and districts can access this and they can see who their foster youth are in pretty close to real time. It's pretty fast how it happens. So what happens in this process is that county social service data is uploaded on a weekly basis to CalPADS. And then our school districts upload information to CalPADS on a regular basis as well. So this process of uploading the data into here for this match, that's what's covered under that DEP, and it goes into great detail on how that process works. So for those who are interested, the next slide is where I can kind of show a little bit, a high level overview of the actual match process. So next slide, please. So this is a flow chart that describes the match process itself. This is, for me, really important because I'm a visual person, but it's a way to break it down, the actual process, for those who are interested. If anybody is interested, there is a link on the CDE website, and I can put that in the chat where you can access this PDF. So one thing to remember when we're talking about this match process, and this is what Alicia was talking about, is that we are only talking about students who meet the LCFF definition of foster. So we start with that group of kids, and then this whole process begins. So we're not talking about the universe. We're only talking about LCFF foster youth. And then that goes into what's called a data integrity pre-check. So there are certain elements that have to happen and that have to exist within the files coming from the data from CDSS. If those aren't met, the match process, those files are excluded from the match process. But if the data integrity pre-check works, then it goes into the actual match process within CalPADS. And so CalPADS is taking that social services data and matching it with data that we get on enrollment for our students from the LEAs. So there's looking for an overlap in school enrollment start and end dates. And if there isn't one of those, we can actually also match on zip codes. So this is what we call a fuzzy match process, because social services and California Department of Education, we don't have a shared data system. We also don't have a shared identifier, so to speak. So Department of Education does not collect Social Security number, which would be like a nice, obvious choice. And so because of that, we utilize this process, and the DEP really breaks it down. So this is probably putting some of you to sleep. I hope not, because I like this stuff. But I think what's really important to point out here is that the DEP, the Universal Data Sharing Agreement, all of this technical stuff is the really important work to get to the point where we result in a matched record, because that matched record allows our schools and districts to access social services data that is really important to get a complete picture of a student's experience. So these are things like they can see who a student's social worker's name is. We can see their contact information. We can see if the parent's educational rights have been limited or terminated. We can see if a child is in out of home care or whether they're in the home under a family maintenance plan. We can see when the date the case was opened. And so this is that cross-agency information that is really critical and really important. And this is the why of why we want to have that UDSA, that Universal Data Sharing Agreement. This is the use case, and it's pretty successful. So I'm very happy about all of this. Alicia, I don't know if there was anything else I wanted to cover on this slide.
I think you covered everything.
Okay. So I don't know, I guess I'll go to the next slide.
Liberty and Alicia, there is a question that's been posted by Lizette, and the question is, does the 300 petition filed had to be sustained or only filed? So that's the first one. And then does it include court-ordered family maintenance and family reunification?
Okay, and I'm thinking sustained. And in terms of the court-ordered family maintenance and family reunification, so we are including those, but as I mentioned, we're excluding voluntary family maintenance and voluntary placements as well.
Yeah, I think, Alicia, maybe the way I think about it is the petition has to be sustained for that information to go into the CWS CMS data system. And then if it's not in that data system, then it doesn't go into the match as well.
Mm-hmm.
Okay.
Yes.
I see it. There's a question in the Q&A. Regina asks, she may have missed this, but what was the time frame for the DEP? Like how long does it take to execute? I think that varies and depends, right, Alicia?
Yeah, it definitely varies. And I do want to point out that our data exchange collaboration really started initially with this particular foster match process. And so this one probably took us a little bit longer than others, but yeah, it really depends on, you know, the urgency, the prioritization within the departments, and just getting schedules aligned so that we can collaborate as often as possible. But I would say, I don't know, average, Liberty, would you say maybe 6 to 8 weeks?
Yep, I would.
The question may have also been in reference to how long is the time frame for the agreement, or how often must the agreement be reevaluated or renewed?
That is, you know, that is specified within that DEP specifically. So this one is until it is no longer needed, I believe, because it is ongoing. As long as we have foster youth in our schools, we need to know who they are.
Yeah, and just to clarify, the larger umbrella agreement, it has no expiration date. So it's an evergreen agreement. Any other questions? Look at the chat.
There is a question in the chat from Randolph in regards to sharing the data exchange project template, if that could be, if that could be done.
Yes, we can do that.
There's also a raised hand. So from Sue Evans. And I thought that we could click on it, but it's giving me a chat option.
I can, let me see, I should be able to let her talk. Would you like to talk, Sue? Okay, asked her to unmute. She should. So if you have something, you should have gotten a notice that you can now unmute yourself, but it might not work. I'm going to say no. That she's not gonna, that she can't unmute.
Okay, well, if you have a question, Sue, you can also type it in the Q&A or the chat, and then we'll be happy to circle back and follow up on that. We have another raised hand. Oh, it went away.
Yeah. Okay, other questions?
I can get started on sharing about some of the resources in upcoming webinars, and maybe we can pause if there are questions that come up during that. How does that sound?
Yeah, that sounds great. Would you want me to click to the next slide?
That would be great. Thank you.
Okay.
So definitely keep posting those questions if you have any, and we will get back to them. And for now, I'll share a little bit about resources. So we have some links for you here on the PowerPoint, some additional resources, and then keep a lookout for some resources that will also be posted to the chat now. Thank you for that, Nancy. These will include, I'll share the title so you'll know what good stuff is there to dig in. Follow that link, and I think we have them in a Dropbox. In the nick of time, 6 domains of primary focus for the National Interoperability Collaborative from the Stewards of Change, and education records of children in foster care from the Legal Center for Foster Care and Education, the State Health and Information Guidance, sharing behavioral health information in California from the State of California Office of Health Information Integrity, Accountable Communities for Health Data Sharing Toolkit from the Center for Healthcare Organizational and Innovation Research, Sharing Data for Better Results, a guide to building integrated data systems compatible with federal privacy laws from Stewards of Change, a Dear Colleague letter from the Foster Youth Information on Foster Youth Information Sharing, from the Bureau of Children's Justice, and then also Electronic Information Exchange for Children in Foster Care, a roadmap for improved outcomes from the Children's Partnership. So all of those you can access through the link that Nancy posted in chat. Any questions that have come up that we want to pause for?
There's a question that asks, can you share the CDSS CDE data sharing agreement and how it fits into the DEP template? So that's a different question.
I would say that the data sharing agreement doesn't fit into the template. The template fits under the data sharing agreement, if that makes sense. Or let's see. And regarding statutory authority, each DEP has different statutory authority. So for example, the one that we discussed today is under Education Code 42923. I can't remember right now. I should know this, but it's the local control funding formula definition of foster youth. There's also some other statutory authorities that that kind of dictate or articulate that our schools need to know who their foster youth are in order to provide them those education rights. And so the education rights in Education Code are another statutory authority that support the need and justify the sharing of information, if that makes sense. Regarding WIC statutory authority, I don't know.
Hi, this is Alicia. Something that may be helpful is if we share our data exchange project that we have where we, CDSS is receiving data from CDE to determine foster youth outcomes, education outcomes. So some of that WIC code you may want to take a closer look at that I'm happy to share with you.
Thank you.
Ashley, there's also a question if the System of Care Toolkit is in the link that I just sent out, which I don't believe it is.
The guidance document for?
It says the System of Care Toolkit.
So the resources that I just shared, I think there's about 7 of them, shared the names of, those are in the link that Nancy posted. That is the UC Davis box. And I am suspecting that may be what you're asking about. There's also the MOU, the AB 2083 Children and Youth System of Care guidance document that is on the California Health and Human Service Agency website. I hope that answered your question, and if not, let us know.
Mm-hmm.
Another question. Where can I find the statewide foster match process PDF? Liberty or Alicia, can you help with that question?
I'll put it in the chat in just a minute. I should have had it.
Thank you.
So we have another question here from Celeste. Are there examples that relate to mental health and substance abuse, since those have strict policy protections in state and federal law with WIC 5328 as noted above for mental health issues? Can one of our DHCS partners answer that question?
Yeah, I didn't catch the beginning of the question. Can you repeat that, Diana?
Absolutely. Are there examples that relate to mental health and substance abuse for data sharing, since those have strict policies, protections in state and federal laws?
You know, that is a good question, and a question I often think of as well, that we don't quite, that I and the team that's on this webinar don't have the answers to right now, but it's something we can look into and then report back at a different time.
If the question is in regards to, is there a data matching process currently in place between Department of Healthcare Services and CDE? I think at this time, the answer is no. I don't think that we have that kind of a similar process in place right now.
Sorry, I thought it was for mental health and SUD. Is that the question? A data match between mental health and SUD? The two programs?
So I believe it has to do with data matching for foster youth with mental health and substance abuse.
Okay. There are very strict restrictions around the SUD data. So let me look into that a little bit more, and we will let you know what we find out.
Thank you.
Hi, this is Alicia, and although there is no data match currently between CDE and DHCS for mental health and substance abuse, we do have what we call a global data sharing agreement between DHCS and CDSS. And it's actually structured very similar to the universal data sharing agreement that we just presented. And we do exchange mental health data, but we do not exchange any of the substance use data. That is still not allowed. So I just wanted to let you know about that.
Thank you. Are there any other questions that folks have?
No, but this is Christine, and I just wanted to share in the box link that was shared out with everybody. One of the resources in there is from Cal OHI, which is our Office of Health and Information Integrity, and it uses substance use disorder patient identifying information in kind of some crosswalks, and there's a lot of visualizations about kind of walking people through an understanding of what and how and with who that specific information can be shared. So definitely dive into that, because I think it'll provide you a lot of insight and guidance specific to what and how substance use disorder patient information can be shared. So it's a really great document with a lot of kind of great crosswalks and visualizations. It's really clear. So yeah, that might be beneficial.
Thank you for that, Christine.
All right, we can certainly address other questions as they come up. Sounds like we might be ready to move to the next slide. Which is just a reminder about the next Children and Youth System of Care webinar. So we will not have a webinar in December. The next one will actually be the second Wednesday in January, January 13th. And the topic will be on screening, assessment, and entry to care, which is the MOU element 4. And then as a reminder, the registration link for January will change. So keep a lookout for that to be emailed out, sent out soon. And then if you
Yeah.
are not.
Oh, and Ashley, you will receive a notice that if you've registered for the January or other webinars, you will receive a notice that they've been canceled. So we'll try to make it clear that it's just that link that's been canceled. It's not the webinar that's been canceled, and you'll get to register for another one. But just know that might be a little bit, you might notice that.
Thank you for that.
Yep.
So if you are not receiving information from us on the webinars, please email us at systemofcare@dss.ca.gov to be added to the distribution list for updates about the upcoming webinars and other TA opportunities. Next slide, please. We are always looking for folks up for sharing where you have partnerships and practices that are working well. Hearing from local folks doing the work is such a valuable opportunity for learning. So please let us know if you have any practices, tools, connections in your county or partnership that you'd be willing to share about on areas related to the MOU. You can let us know by, certainly you can put something in the chat or send us an email at that address. I will make sure it is in the chat again too.
And it's System of Care at, we got it.
It's coming
Diana,
up on the next
Diana
slide.
put it in. She got it.
Okay.
Thanks, Diana.
Thank you. And then you'll see it again on your screen with this next slide.
There we go.
So there's that email address. Please reach out with any questions or ideas or interest in sharing some of the, highlighting some of the practices happening in your county related to System of Care. And then our last slide is a reminder with a link about the System of Care technical assistance request form. So in addition to having the System of Care inbox, the email, once local resolution process has been exhausted, a request for technical assistance may be made to the Children and Youth System of Care State TA team and submitted via the provided electronic forms found at this link, the SurveyMonkey link. Trying to make it simple for you. Definitely want to hear from you if you're having questions or needs for TA. So reach out, let us know. We certainly thank you.
My mouse today, it's got one of the wheels in it.
We got to have some fun somewhere in our technology. We thank you so much for your time and participation today. We thank you for all the work that you do to support and serve the children and families of California. We sure hope to have you join us January 13th for the next webinar, and stay tuned for that registration link for that coming out soon. Any other questions we want to? Yes, we can definitely put the technical assistance link in the chat.
Sorry, did you want me to forward to the next slide, Ashley?
These are for accessibility. So
okay,
we can hang out.
So we'll end right here.
There.
Okay, perfect.
Yeah.
And then Ashley, maybe we can just kind of touch on the posting of the PowerPoint slides and potentially next steps for posting of the webinar.
Absolutely. You want to share an update on that or share what you think would be helpful?
Sure. So basically, we'll put again in the chat the link to find all of these webinar slides. They'll be posted on the California Health and Human Services Agency's website. We kind of have a System of Care hub there. And so you can find lots of information related to System of Care and some, informational kind of support documents, and then we're working on getting the actual webinar recordings fit for accessibility and meeting accessibility requirements. So stay tuned on that. But I imagine that the information for accessing the actual recorded webinars will be posted on that same website. So that website is definitely our hub. So stay tuned for the recordings, but if you need the slides, you can find those there now. Thanks.
Great, thanks, Christine. Okay, so does that conclude the webinar today?
I think we've wrapped up.
Excellent. Thank you, everyone, so much for joining us today. If you have any questions, you can email the System of Care email address. Watch out for invitation for the January webinar. Hope you have a good, restful day. Thanks, everyone, for joining.
Thank you, everyone.
Thanks, everyone.
Thank you, Nancy. Thank you, Alicia and Liberty, and everyone for joining.